licensed social worker here at Transformations Counseling. So I actually spent 13 years of my career working as a nurse and seeing how so many of the patients were struggling mentally and emotionally. I spent time working as a psychiatric nurse in an adolescent unit where I really started to see and feel like I wanted to help others heal emotionally and physically, and that healing came from more than just administering meds. My goal as a therapist has been to, help my clients to develop greater insight and tools and resiliency that allows them to live their life to the fullest. So every day people face challenges, and oftentimes they might not have the tools or the support that they need to really work through those challenges. My passion as a therapist comes from helping people to develop their toolboxes and their building themselves up, because I believe that everybody deserves to be whole and to enjoy their life to the fullest. I know that I've done my job as a therapist when my clients no longer need me. So I use a combination of three different modalities primarily. One would be cognitive behavioral therapy, where I strive to help the clients challenge their current behavioral patterns and figure out ways that are appropriate and healthy to overcome specific negative or harmful behavioral patterns. I incorporate DBT, which is dialectical behavioral therapy, through challenging their negative thoughts and encouraging growth mindset. And then I also can sometimes incorporate mindfulness, which helps the patient to learn how to kind of live in the present and develop specific coping skills that allow them to overcome anxiety or depression or symptoms that are happening in that exact moment when they're in a real life situation. Combining these three different techniques really helps the client to have a well-rounded toolbox to where they're able to pull any of these different coping skills or tools out when they need to in real life situations, and they're able to cope with everyday situations that pop up. So I start by really focusing on what the client feels is what they want to work on, what their goals are, what they want to work through specifically. From there, I help them break this down into small, measurable steps that we can take and help them identify different behavioral patterns, and building awareness and establishing concrete coping skills that they can use in everyday life. In the end, it's a partnership. I am there to guide, support, and challenge them, but they're the ones doing the work. And then that makes the progress that they experience so powerful. So during our first session, I'm really just going to focus on a lot of building that rapport and helping my client feel comfortable in therapy. I know that this can be a scary transition for anybody to take, and I want to make sure that during this process that they are feeling validated and seen and encouraged about the whole situation. We might talk briefly about what their goals could potentially be, but goals are fluctuating throughout process, so those can also change throughout time. We might focus on, what's bringing them to therapy, but my overall goal is to help them create a safe, non-judgmental environment where they feel like they are being seen and that they're hopeful for the process ahead. So I really enjoy working with adolescents, young adults, women, and couples. As a mom one of my children is struggled with mental health throughout her childhood, I come from a place of deep understanding and relating to the other side of the coin. Additionally, I really enjoy helping couples to regain their footing with each other, to really deepen their relationships and get back to where it was that they want to go. I enjoy working with victims who have experienced complex trauma, domestic violence. I have experience working with patients who struggle with, major depressive disorder, bipolar disorder, anxiety, autism spectrum, ADHD. So if you think that there's anything that you want to work with on me, feel free to reach out.